impaired sensation, attentional difficulties, abnormal tone, movement disorders, intellectual disorientation, or poor comprehensions. It's very common, the apraxia is very common, which count around 28% of the patient with a stroke. I will be very brief about the two types of the apraxia, which is the idiomotor and the ideational apraxia. Okay, the difference between both of them, the idiomotor apraxia is referred to a breakdown between the concept and the performance. Okay, what that means? Let me just turn that off. Okay, the idiomotor apraxia is a patient that understands the concept of the action, but he will not be able to do it under command. Like, for example, if I have a patient and I ask the patient to grab that bottle of water, like to walk to the table and grab that bottle of water, he will not be able to do it. But actually, if I leave the room, he will go and he will walk and he will grab the water. So there is no problem with any of his movements or his physical capabilities, but he has a problem with actually doing any motor execution or doing any physical activities upon a command. Like, if you ask him, for example, can you have that comb and you just brush your hair, he will not be able to do it in front of you if you ask him to. But on the other side, his wife will tell you that every day in the morning he wake up and he comb his hair. So this is the idiomotor. The ideational apraxia, he has no idea about the concept or the movement. He will not be able to do any of them, even if you give him an order, if not, he will not be able to do the action. So he will only be able to do part of the action. He may get up and walk and forget what he was here for, and then he leaves. So he just do a part of the action and then he forget about the rest. This is a type of the patient that he is clumsy. And this is a patient that has a preservation. He keeps repeating things. And he will have a problem with the ADL. This is the same thing like blow a bubble. Like if you ask him on a command, he will not be able to do it. But if you leave the room, he will do it. For the treatment for this patient with apraxia, we have to speak slowly to this patient, give one command at a time. We have to break the order into components, not give all the orders at once. And a repetition is a very important factor for the treatment. We said the ideational apraxia. Some tips is just maintain a relaxed, calm environment for this clumsy patient. Take a time to show someone with apraxia to do a task. Just be patient. If you figure out that the patient is struggling with the action or with the movement, just try to give him another action to do. Show him any other alternative ways. Okay, now the second characteristics of the left brain injury is the aphasia, and this is a very common problem with the stroke patient as well. The aphasia is a language disorder characterized by a difficulty in producing or understanding written or spoken language. It is an patients with aphasia each year. 3 types I will be talking about the aphasia. There is actually many types of aphasia. I will just highlight 3 types. The first type is the fluent aphasia. Fluent means that this patient can speak, but he has a problem understanding the speech. But actually, if the aphasia is so severe, even with the fluent aphasia, the exactly. An example, for example, he may say car. He may say car, and he means couch. So this type of patients, actually, we have to deal with them as a toddler. Like, you have to baby that patient. You have to tell him, oh, do you mean car? Yes. So, yes, absolutely right. He may say word, which sounds as a word, but it has maybe different meaning or different word. Non-fluent aphasia this is a type of the stroke patient that they cannot speak, but they understand. They understand that they have a problem. They understand what you are saying to them. They understand what kind of impairment they have. And this type of patients are very cooperative, but they are very, very frustrated patient because they understand you, but they cannot actually communicate with you. And this is a type of the patient, everybody knows that this is a type of the patient that keep repeat words, like spin, spin, spin. We just have a patient keep saying that every day. Her name is Spencer, and she keeps saying spin, spin, spin. Like you ask her, yeah, Miss, okay, that is. So you ask her, how are you doing today, Mrs. Spencer? Spins, but she knows what you're asking her about. Yes, and they will get very frustrated very quick, so you have to be very patient with them and with the family. Like this type of patient, even at Southern Crescent, we do meeting with the patient as a care plan meeting every week or every 10 days to just kind of help them with their frustration, because they get very emotional that they speak to their mother or their loved one and she is not repeating them back. Global aphasia actually is it's not a different type, it's just a type of severity of the aphasia, how the severity of the aphasia coming along that can cause a global aphasia. Different tests we can do to the patients, and we have a Mecca here also singing to Mr. Spencer. He's a good singer, and this is a good type of therapy we do at Southern Crescent. Is we keep singing. This is a melodic intonation therapy. Is you sing them songs, and by the time they will start saying words with you. Other kind of treatment you can do for this patient is asking the patient to count when they do any physical activities, like 1, 2, 3. They will be frustrated in the beginning, but like one by one they will be able to do it. Because of what? That's a very nice question. Anybody can answer that question? Can you repeat that?
I asked, why does singing help? Is it because of the tune, and does it work for people who are left brain functioning people without the creative writing of the writer?
For one, this probably has to stimulate both sides of the brain because you get to see smart musical creative knowledge. And also like the 80s rhythms, like we tend to hold on to things longer when we have an auditory.
That's a perfect answer. Because, as we said in the beginning, the brain is not only one part of the brain that works, it's different parts of the brain that works. There is part of the brain that can remember words, there is part of the brain that can remember songs, there's part of the brain that like remember music. So you actually stimulate different parts of the brain. There is something called, and you can all Google that, savant. Anybody hear about the savant before? So this type of people they may actually have a complete memory loss. Complete. They cannot, even if you say anything like an immediate memory loss or short or long-term memory loss, but they still can play music perfectly. They can play music, they can play piano, they can play violin, anything. Why? Because there is different parts of the brain that works, not only one part. Okay? Okay, tips for the family. I'll just go very quick. It's a long one. The patients, this is the tips for the family. As I said before, you have, of course, from number one, problem or impairment, we have to communicate with the family. But there is things that you have to be very careful talking to the patient about. One of them is aphasia. And the tips for the family is the patient needs stimulating and understanding companionship, feel loved. A patient is left like if the patient has to be involved in the activities, not just left alone. Here it is. Patient may say car and he means couch. They repeat the same word over and over. You have to speak slowly and use simple words to the patients. There's a lot of actually softwares, even on the computer or on the cell phone, that can help the patient with aphasia. They give them word by word and they keep repeating it. Don't overstimulate or underestimate the recovery of the patient. You have to put the patient in a proper posture to treat them.